Hello, everybody, and welcome to a new webinar part of the ECHOS project, uh, Cancer Mission Impact Practitioner Series. ECHOS stands for Establishing the Cancer Mission Hubs, Networks, and Synergies is one of the key projects under the Cancer Mission. My name is Marius Geanta. I'm the Work Package 3 lead in the ECHOS project, and I'm representing the Center for Innovation in Medicine. And I'm very happy to moderate the today discussion with Annika Nowak from European Commission. Thank you for joining us today, Annika. And the topic of our today discussion is around the vision of the EU Cancer Mission and very practical funding opportunities. So I think we'll have a very on one side, very interesting discussion around the cancer mission vision, but as well a very practical part on how actually the funding follow the vision and what are the opportunities in this regard for the cancer mission implementation. Of course, I hope this webinar to be as interactive as possible. The floor is open for you for any questions or comments. Please use the chat or Q&A function in Zoom in order to address the questions. So once again, thank you so much, Annika, for joining us today. And I will actually give you the floor. You prepare also some slides, and then we'll continue our discussion.
Thank you, Marius, and good afternoon to everybody. Thanks for joining this afternoon. So indeed, I have a few slides which will also provide some information on the funding, but also on the other actions, missions, portfolio of actions, as you may know. So that's why the first slide will give you this overview, what's the cancer mission about, how we have translated the overall goal of improving the lives of more than 3 million people through prevention and for those affected by cancer and so on. So, it's an ambitious goal, which we have translated and laid down what we call the implementation plan, a document which was published at the moment of the launch of the missions 3 years ago now, almost 3 years. And the funding follows very much what we have outlined there. So we still consider this as an operational basis of our activities, be it on funding, be it in the area of citizens engagement activities and of communication, of interaction, or dialogue with member states and stakeholders. I don't see the slides. I hope you do see them so that I can adjust my speaking. So we're on the first slide, but we can already move on so that you can briefly take notes. So as I said, that's more or less the mission, the cancer mission at a snapshot. Very briefly on the concrete actions. Yes, it is very much about R&I actions, which we try to address each time under each of the 4 objectives. Building synergies with other initiatives, also in terms of funding instruments, they are very important. One of the main, key characteristic of all missions, but in particular for the cancer mission, is the joint governance when it comes to the dialogue with the member states and the stakeholders. And for the member states, there's on one side what we call the public health expert group, the cancer subgroup under the public health expert group, which joins health and research ministries for policy dialogues on the implementation of both the cancer plan and the cancer mission. We have the health policy platform for interactions with the stakeholders. And to duplicate this joint approach in terms of governments, that's what we came up with the ECHOS project to have national mission cancer hubs in each of the member states and associated countries, and the citizens engagement activities that accompany many of these actions. We can move on. So that was, the summary. Short zoom in, we have 4 flagship initiatives. I won't go into details into that, but with the notion of where we do put the funding, obviously we prioritize the funding also to build these flagship initiatives. And within these 4, each under one under each of the objectives, we have prioritized so far to preparatory actions to build the Uncanny EU data platform, as well as the European Cancer Digital Center. Why? These are major actions, so we had an early start. We know it's very complex, while the others, we are more, well, particularly with the Cancer Prevention Center, that's more still internal discussions. What should be the concept? What would be the added value, also in view of existing initiatives? And for the comprehensive cancer infrastructures, a lot has been invested already in this respect from both the cancer mission side, but even more from the cancer plan side. So for each of the actions, we look into which funding instruments can we use, where can we build the synergies to avoid the duplication of investments, but also really to streamline them and to obviously to increase the impact. We stay with the CCIs, there we look obviously more at the research capacities. Well, from the EU for Health program, it's about building the comprehensive cancer center, upgrading them, and so on. So joint actions and other actions. We can move on and still take a moment, because yes, we had the implementation plan, the official launch 3 years ago, but 2 years after, we had already a first assessment of the progress, which was early on, but it was a kind of legal requirement by the Horizon Europe regulation. With the missions being a new instrument, they are more kind of scrutinized, looked on the usefulness, on the mission characteristic, and the first findings was on one side, yes, they made progress. It seems to be positive, but still obviously there are challenges. So these challenges, I put them, the three main challenges relate to the governments, which are complex, at the different levels and the different bodies involved. Even for the cancer mission, I can spend 1 hour just on governments, but you can stop me. The political steer needs to be stringent at all levels, but even more at the national and regional level, because these are the levels where the decisions on healthcare, on innovations, integration are taken, and also on investments into cancer control. Investments are important, and they should also come from the private sector. So that's something we are now looking into through the current calls, so the 24 work program. I can come to that in a minute. And there's a strong push that we need to enhance the citizens and stakeholder engagement. So on one side, the communication, but really also the engagement in terms of citizens engagement. I come to that at the end of my slides, what we have done already. So I can jump into the work programs. So far, we have 4 work programs. 370 around has been committed through the first 3 years. 24 is just out with around another, I think 120, or a bit more probably, budget. So each year we had a more or less similar budget, and what we tried, and that's a bit of logic, that we based ourselves on the implementation plan, which outlined most, if not all, of these actions, which also gave some timelines when we should implement these actions. So that was really our guidance book, so to say, how we planned the different work programs, how we prioritize certain topics in close discussion with the member states, because these are the ones that have to agree to all of this. But as you can see, the House, as proposed by the First Cancer Mission Board, with the 3 pillars and the basis of understanding, we are trying with each year, with each work program, that we have at least one topic in addressing one or each of the 4 objectives. And that's where we stand now. So far, as I said, we have prioritized, and even more in 24, investments into building the digital initiatives. We tried to put a lot of emphasis also on clinical trials. That was always a big demand, but it's quite diverse, I would say, on one side, but at the same time, it's really trying to be complementary within the work programs, as well as also complementary to what is being financed under the EU for Health program. And with that, we can move on to the next slide, which gives you, it's non-exhaustive, but an overview what we have achieved so far in terms of building synergies with other funding instruments. I mean, first of all, within Horizon Europe, that we where we have placed some calls in close collaboration with the colleagues working in these areas. So we have, I mean, I can highlight, yes, obviously research infrastructures are important for our digital initiatives. We are always looking what we can have specifically on cancer in the innovative health initiatives. So far there were 3 core topics in 22 and 23, but equally in the European Innovation Council, the EIT Health. Other funding sources, so other than Horizon Europe, Digital Europe had a couple of cancer-related topics, which then are also important to implement parts of the mission. Well, notably the EU for Health program, which in itself, to implement the cancer plan, has so far over 550 million programmed, 21 to 24, which is, I mean, it's considerable. And since some of the actions like the Uncanny EU platform and others are also part of the cancer plan, obviously we looked at how we can also then combine the funding from both programs. As I said, the communication adopted last year identified also the need to expand the funding sources also to private funding. So we had started some time ago a dialogue with the European Investment Bank. They do finance cancer projects or trials even since quite some time. We looked into the advisory service that could help member states to guide investments in support of the comprehensive cancer infrastructures. So they will pilot with 6 countries first, but then obviously we hope that we can expand that also in the future. Transcan, ARANET plays a role, and even more that we also want to see more and focused on the mission. So these are instruments which already existed before the mission, but now with the mission we are trying to channel and to focus their funding or prioritize their funding in support of the mission. And then for the cancer charities, it's also a dialogue which we started. There is an informal network that these charities have set up themselves. And with the 24 work program, we are trying to, support this coordination among the charities, which then would, combine their funding for clinical trials. So these are some examples. You can also name the Resilience and Recovery Fund, where some member states did quite some considerable investments parallel to the making of the mission in view of reinforcing the infrastructures, building even new comprehensive cancer centers, which obviously is a very positive development. Going on further, and I can be quick. Funding is important, but missions go beyond. That's why communication plays a major role to engage, to reach out, but also to show what the mission approach can bring in terms of benefits. It's about reaching out, it's about engaging, but really also seeking sort of citizen engagement, the feedback from citizens. I can give you an example later on. So we had few publications, a new website since March, so I really invite you to look at this. And last week, finally, we were able to publish a first newsletter, which gives you a good overview what the mission is doing and gives you the links to more information, and obviously guides you back to the implementation website, so please check it out. Then briefly, one example of an ongoing citizen engagement activity, which is the Pilot Buzzword Show that started on the 9th of May in Vilnius. So it's a pilot in 3 countries, Lithuania, Romania, and Poland, with 5 events in each country. And the idea is not just that we park the bus somewhere, but early on we involve the local stakeholders and public authorities that are at the bus. It's local doctors and patients organizations that join us, interact with the citizens, give them information on prevention and screening. So far, very, very positive feedback and great engagement. It's linked to events, festivals in these countries. so that people are there and then can benefit from these information campaigns, so to say. So it's information on also on research innovation in the area of prevention and screening. With that, it's still ongoing until the beginning of September. Now it's in Poland, and the next country will be then Romania. So, and then the final slide, that's more advertisement, but also showing you, what kind of other activities we have. It's a conference. We had a conference last year with young cancer survivors. So as part of our citizens engagement activities, we built a kind of network, a big group of young cancer survivors. We had several workshops and then a conference last year. This group still remains. This year, the focus is on innovative palliative care for people with cancer, going beyond young cancer survivors. So any patient that needs palliative care. So preparation with workshop, with experts or workshops, but then the conference itself will be on the 8th of November. It will be hybrid. So if you're interested, the registration platform should be open next week. And with that, I can close my short overview, what's going on and how we have rolled out the mission so far.
Thank you so much, Annika, for your presentation. As I mentioned, the floor is open for questions and for comments from the audience. Please use the chat function or the Q&A function here. So we're waiting for your questions and comments. And I would like to ask you, Annika, Cancer Mission has an ambition, and you actually presented at the beginning, and is on implementation for more than 3 years at European level in different member states. And people already started to ask, about the impact. And we all know that it's too early for, to have magnitude of impact. But I actually have two questions. Do you have some early signs of success from the projects that are on implementation now? And how we can somehow be sure that we are on the right track on the Cancer Mission implementation, based on what is achieved so far?
Yes, thank you. So, yeah, that's there's questions we received from all sides, so to say, yeah. Which is valid. But as you said, it's very early on. I mean, we launched the mission 3 years ago with the communication, with the implementation plan, but then we only started, next day to work on the first work program. And this obviously takes a lot of time, so to say, because it's not just us that can decide on work programs. Anyhow, I think, yes, we see early signs, and it's more and more kind of systematic. I mean, in the 23 communication, there are some early success stories or progress we have seen. There's also a staff working document, if you're interested in more detail, that at least echoed the mobilization we have achieved in the first 2 years, the mobilization at the national level, in terms of, I could use the recovery fund to do investments. I should build a mirror group at national level that, takes the same approach, putting the stakeholders together. This mirror group that could be then, become a partner in the ECOS project. It seems there are episodes, but there are more and more, and also more covering more and more member states. Obviously, there are front runners that from the beginning said, that's nice, we go, and that's anyway something we would wanted to do, have a different approach in terms of I&I on cancer control, combine it also more with the policy side of things. But we see that member states follow that approach. I wouldn't say they fully embrace it because it's new, because it's sometimes not that clearly translated. They see now the benefits of having, these joint governments. The Commission works much closer together in a certain domain. Then we have the cancer subgroup. Yes, it's the main two main ministries, health and research. More and more they realize there's no finance ministry, why there's no the environmental ministry, rightly so. But that's obviously what we then advocate. do it at the national level, put the right people together to absorb what is going on at the EU level and have a good implementation, but also benefiting them from the funding. We see these developments. We need sometimes to be better to present these, because I think in cancer, this is what is important. In parallel, we have launched about 447 projects with the first 3 work programs, which I think is impressive. I mean, they've all started. We have them clustered, what we call project clusters, so that they also work together and not in silos in a given area, let's say understanding. Last week, we had the first policy webinar where we zoomed in on this cluster on understanding, what's the benefits of collaboration brought by the mission, what are first results, and then also looking, what if you have results. Anyhow, I mean, there are a lot of things that are ongoing, and we see that more and more people also can, connect to that the interest is still increasing, but it's still a long way to go. So that's coming then to impact. Yes, we need to monitor, we need to define what is an impact, what makes the real change. So far, as I said, we see a lot of good developments, also that member states start changing national strategies to be more also focused on innovation, to more absorb what comes from the research area. But it takes time. It takes time because of national context, of national difficult discussions, of national investments, which were also, I wouldn't say stopped, but they had to reprioritize because of the pandemic. This is something we need to take into account. So overall, I would say we are on the right track, but we need to still be very, forceful to continue the way we have been doing so far, securing the support of the member states. That's important.
I would like to spend a few more minutes on this relationship between European Commission and member states, because as you mentioned, it's something, the mission itself is something new. Actually, the 6 missions is something new for European Union. The cancer mission is new, but as well Europe's beating cancer plan was something really new at European level as well. And at the national level, a lot of countries actually started to build their own NCCP. So what is your advice based on your observations so far on the cancer mission, the interaction with the Europe's beating cancer plan, and national level, let's say, implementation or adoption of the cancer mission recommendations and the Europe's beating cancer plan actions and flagships?
Yes. So first, I mean, when we started and developed in parallel both the mission and the cancer plan, that's why they're really not just closely linked, they really work as a tandem, which again wasn't an easy thing to work out on our side. And seeing, I mean, the difficulties we had to align the priorities, to clearly define what are the scope of the 2 instruments, then going out and saying, oh, great, now we have 2 cancer initiatives, created first a bit of confusion, while we needed to clarify what's the mission concept about and why we have now a mission and a cancer plan. I think now people realized that this was a unique opportunity or unique situation, let's say, having such a attention, let's say, at EU level, and investment, obviously, that was linked to that. So we had to, when rolling out both, run fast, both with the cancer plan as the mission. So there were so many topics, so many activities at the same time, that the reaction of the member states who struggled to see, okay, where's my fit? What is my interest in this? What do I gain from? And then to absorb what is there in terms of, participating in joint action, participating in coordination and support actions launched under the mission. And some smaller member states always say, I mean, please, take more time. We don't have the resources to follow, what you have. I mean, you are kind of expecting from us, or at least you offer us in terms of, participating in the activities. That was a political priority. Sometimes is the situation like this. We couldn't say, we do it in 5 years. It's now I wouldn't say never. So there's a struggle. I think now, hopefully, it settles down a bit, and it's also about, building the synergies that you make the link between. And even this is not obvious. You have different timelines, you have different people engaged. Many people know each other, but still to get some order in who does the coordination. This, I think, here and there still a bit of open questions. So it's not ideal on one side, but that's how it is at the moment. And we try now, I mean, the ECOS plays a role, but also we as the European level, we need to, have a clear dialogue with the member states saying, okay, this action is there, this comes here, this, who does what, so to say, what will, link up, and where probably we still need to clear the boundaries that we, don't duplicate the efforts. It's like this. I think it's a challenge for everybody. I can confirm also on our side. But sometimes it happens like this. Let's see what's next year. What is the other priority?
Indeed, it's a learning process that is running actually in parallel with the implementation, with the development of policies and work programs. And so it's a lot about learning, and we experience this in ECOS project and as well in other projects. We are always on a daily basis actually learning something new, because the mission is something new, and we'll discuss about the stakeholders engagement, the citizen engagement, because this is really in the core of the cancer mission. And but first we have some questions from the audience, so I would like to go for them. So I will start with the third one. Are there plans to expand the roadshow cancer mission bus to other member states?
Yes, there are plans.
Yeah,
I mean, I shouldn't talk about work programs, and I haven't, but based on the very positive feedback from those involved really in the roadshow. So it's not us driving the bus, obviously, but it's really the local people, healthcare providers and stakeholders that support this. I mean, before, but being on the spot. And I think this in itself is great, but also the citizens that pass by and think, oh, that's EU, wow, interesting. I take a look. Yes, definitely. It was a pilot, so we had to make a selection. But there we see, obviously, we need to justify where to invest. But there we feel it's really an investment, and we have member states saying, please, next time come to my country and do the same. So a big yes. Still to see in which countries, which volume, but yeah.
Good. There is another question on the structure and culture of DGRTD, HADEA, and RIA. And the question, actually the comment is, dear Annika, thank you very much for your presentation. We can question impact of the mission on its target population, but I would like to explore about the impact of the all 5 missions in the European Commission structure. And the question is, do you see any changes in the internal structure and culture of DGRTD and HADEA as a result of running mission-oriented funding schemes?
Oh, interesting questions.
Yeah.
Looking into the future shape of the Commission. I can't tell anything about that. I simply don't know. Maybe we know more once the Commission President is confirmed. But what I can say in terms of collaboration, and that's not only with HADEA, it has really brought together the services. I mean, they work together, but this is with DG Santé on a daily basis. This is new, and I have spent 15 years in DG Santé. So same with the colleagues in HADEA. They do the implementation, but this is not obviously separate from us designing the work programs, discussing that with member states, being behind the policy of the things. No, it really goes hand in hand, and we're really complementary also when we speak in public. So HADEA was founded or built when the mission was launched. So it was also, so to say, new that they had to implement then the mission on their side, and not with regard to the programs and the projects within RTD. But I think we managed well. It's not a distinct area, but really a close dialogue on all sides.
So one more question. You mentioned a new communication campaign starting after the summer, and looks like the people in the audience today are really interested into the future activities of the European Commission. The question is, will this be about communication in general or on a specific topic like prevention, screening, funding? I can add different types of cancer. Maybe you can share more about this communication campaign.
Yeah, I cannot.
Or not.
But we still need to, well, we have, I mean, it's a clear plan and we have the budget for that, but we will need the help of a contractor because being big means resources, but even more important, to be present also in all member states in the language of each member state. So, but that's the aim. It really goes back to what were the findings of last year's assessment, that the mission, more or less known in the Brussels bubble, and those working in the cancer area, but beyond, it's difficult. And in the end, it should be really, also informed citizen stakeholders that should know about and think, oh, this sounds interesting. Can I somehow contribute or be involved in that? So for that mainly, so it's not focused on a specific area compared to the bus roadshow. This is on prevention and screening. No, it should be broader, definitely, but then adapted also, in each country, what is the main focus and interest to have, information, an event, and so on.
Thanks. Now I think we can proceed to the next question. And I remember from our ECO's General Assembly in Cluj-Napoca, like 1 month ago, one of the keywords was synergies. And you already actually explained how we should understand synergies when it comes to cancer mission in relation with the Europe's Beating Cancer Plan, synergies between European Commission and then member states, synergies between the project, and you mentioned the clusters, but as well you mentioned the synergies between Horizon Europe, EU4Health, Digital Europe, FranceCan, private funding, and I think this is very important. And the question actually referred to the synergies between European and national cancer research program. And the question is, how can national cancer research programs support, align, apply for funding for projects? The question is under ECOS, but I think we can expand to the cancer mission in general, the question.
But I still need to understand, so how national programs can benefit from EU programs? Or
yeah, I think the sense of the question is more on building synergies between European funding programs and national funding programs.
Okay. Yes, at the very beginning we claimed that by building a strategic research agenda, we would then also streamline the national funding. To be honest, I can't tell you whether this has happened. That each member would say, oh, if the Commission or if we at EU level finance this and this, then it means at my national level I do it differently or I complement. That was the initial idea, and I think that's still what we're aiming for the simple reasons they're limited resources, so we need to see where we put our resources, and that should reflect what member states will guide us. What we have done is a bit less for the 3 first work programs, which we have, where we have consulted the member states, but we were quite under time pressure to develop them, to get them adopted. They were really strictly based what we had outlined in the implementation plan, which the member states have seen. So for 24, we started early on, really, months before, to have the discussion with the member states, saying, okay, look at the implementation plan, but what beyond you see as a priority, which you don't fund, where you want the EU fund, even, our on average 120 million are limited if it comes to clinical trials or understanding. But this is a bit the process that they should guide us early on, where they see the value of the mission to invest. So I hope, obviously, since we can't address all, that then, member states can do complement. but still, I think there are still difficulties in, our timelines and requirements, and how member states can, guide their investment. Probably takes more time, but I think in terms of how we discuss it, how we try also to engage then, and that's probably different than member states do, let's say for the young cancer survivors, they helped us to design a topic so that we bring different value on how we place and how we design the topics. Maybe as an example, how member states, also develop their funding programs. But maybe this is still too early to say, to have this clear streamlining and complementarity between the national and EU side. Yeah.
Yes, and I think I can add that once in place, the national cancer mission hubs can or could contribute to increase the awareness of the mission, to engage actually in a dialogue with the national research agencies in order to to prioritize the mission at the national level. So probably we should wait a bit to finalize our work in ECOS, to have as many as possible national cancer mission hubs or in place, and then to see what the impact of the national cancer mission hubs could be on this topic. One more question, because you mentioned in your presentation the EU Cancer Prevention Center, and there is a question, can you please elaborate more on this? What is this about?
Yes, I mean, this is still in phase of discussing the concept among Commission services. The idea goes back to the mission outline or the mission recommendations by the first Cancer Mission Board, that felt that there's so much evidence out there already on prevention. So we should find a way how we translate that, how we get implemented this evidence, but really on a continuous basis, so that we have a kind of central place, also with a clearance function to say these are the top 10 evidence in the area of, addressing smoking, addressing other behavior, risk factors. So, which in itself, and also, whatever innovation and evidence will come now from ongoing projects. This is the basic idea. So what does it mean at your level? How we, can build such a center, a platform, website, everything. I mean, it's very at the conceptual level. There are other initiatives launched by DG Santé in the area of NCDs. GIC plays a major role in looking at the landscape, what is there in terms of innovation. So this makes it a bit more complicated now for us to figure out how exactly we can combine these, and also, is it then of value for member states, because the idea is they seek advice. Oh, I would like to design a new policy in the area of that. Would you have advice? What kind of evidence is there? Is that validated? Are there best practices I can learn from other countries, so that they get a kind of a package of information, advice they can then use, and in the best case, they can also then get EU funding for that. But that shouldn't be the role of the Prevention Center, giving the advice or the evidence, and then help member states in implementing prevention strategies.
Yeah, thank you. Thank you for all this information. Very useful. I think that prevention, and especially primary prevention, could benefit a lot from the cancer mission approach and tools that are under development in different projects. So I do see this really useful in order, as you said, to have the clearance to put all the evidences together, that evidences that can come from, let's say, public health, but as well from other areas as well. I have in mind the living labs. I think this is a tool that started to be used more often and in projects related to the prevention. So we have other questions. Wow. So there is a significant number of projects in cancer area funded by ERC, widening EAT. And the question is, are there plans to expand the project clusters to these other project to these other funding schemes under Horizon Europe and also to EU for Health?
Yes, a clear yes, and now the clear but. We are not yet there. So first, first we had to wait that we have had projects, new projects launched under the mission, and then each time we created a new cluster, a new batch. So now in the area of understanding, we have two batches of clusters or two clusters within one bigger cluster. This already are now, I can't remember how many projects we had now last week in the webinar, not all of them presented, but being part of the cluster. So two things. Yes, first we want to enlarge that for each of the cluster to add on the other projects that have been already launched, ideally even those launched under Horizon 2020, which are still ongoing, is many of them, to build the synergies beyond these mission projects. And second, and that's what we were aiming with last week's policy webinar, we want to open up, expose, inform, but also expose these projects that stakeholders can say, oh, this is interesting. Well, that's still early, but I know maybe in 3 years I might get an interesting result from that specific project or from the combination of projects. So this is new, and this is again something which needs time to, for people to accept. The matter or the fact to collaborate in clusters was well appreciated, so they use it for certain activities when it comes to communication, when it comes to data aspects. So they have agreed on certain activities they would do in common while doing each of them their specific research work. So this is more or less built for all the four, the clusters for all four objectives. Now we get a request, we should have also a cluster for projects related to childhood cancer. Yes, why not? So we can expand that, and we will do so, but it's really translating also quite a work for us, which is a good investment. But again, it's a bit of time factor that we need to factor in before we expand to EU for Health and others. But yes, as you've seen from the policy webinar, there were other projects from IHI that we put on the panel that, they start a conversation also outside their own cluster. So clear, yes. Be patient.
A follow-up comment actually on the question on prevention center, and the comment is it would be good to link the center to the activity of the Council of the EU, namely the Council of the Ministry of Health. So yes. This is a suggestion very well taken, I think. And there is another question. I don't know if you, Annika, you're the right person to answer this, but I will ask the question anyway. So are there resources under ECHOS which foster collaboration across EU member states and researchers? So this is the question.
Okay, if I understand correctly, if ECHOS has funding to foster the collaboration.
The collaboration, yeah.
Well, if then I would say rather limited, because the focus now in the current phase is really to build the hubs and the network. This obviously is already done in quite active interaction with the stakeholders that are needed to be part then of the hub. I think this is a step maybe later. But it's more and more seen like this. If there's such a visible entity at the national regional level, it would obviously then may have this kind of coordination outreach role. Again, the idea is that they absorb what is going on at EU level, the policy, the innovation side, the funding, and see, what does it mean for us as a country, how we can benefit from that, which stakeholders we need for a certain policy or innovation action. Screening is always a good example for that. And with that, I think you reach out to your research communities and build the relation and make them more, aware of what's going on, and also in terms of funding opportunities. While I need to stress, there are the national contact points that give them the specific advice on the work program. So that's a fine line, I know, but that's their specific role. But yeah, we need to see what's the landscape to make it not too complicated, but to have a great kind of environment of exchanges.
Yeah, your answer actually links, I think, very nice with the next question, which is related to actually the governance of the National Cancer Mission hubs. And the question is, what is the Commission view on the development and governance of the National Cancer Mission hubs network?
Ah. So, well, there's no fixed model or view on our side. We put it in the topic very basic, which was at that time a bit subject to it's not very clear what you want from us, but that was on purpose, so to say, because obviously member states' health and innovation systems are very different, so that requires different concepts and approaches how to build a miracle. And we have seen, I mean, mission hubs, mirror groups, they've started building 2 years ago, and they're very different, but that's great. So it's for us, it doesn't matter. I mean, in the sense that how this concept or this hub is then built, or which concept is behind, and that's part of the discussion, major discussions of ECOS. The importance is to be very inclusive, to be very open, to be, I would say, dynamic in terms of adapting, and really adapting also to the national needs. So that's most important. And then to do this kind of translation and channel between the EU and the national and regional level. So that's probably a vision, but I would say it's just a very broad outlines, and then it's we leave it for the ECOS partners to figure it out. But different models. It's not the one size fit all model. No, on the contrary.
Yes, and I think this is one of the strengths of the ECOS project, that is really open and can include what you already said, all the potential models that can fit and address the needs. And discussing about needs, we discussed about National Cancer Mission hubs, but you mentioned the regional implementation, and this is a topic really interesting if we consider that in the core of the cancer mission is the citizen engagement and working with the communities, and at a societal level. So I think from a conceptual point of view, it makes sense to think how to implement cancer mission as close as possible to each of us as individuals, as citizens. So probably it's too early to discuss about the regional and local approaches, but I think for our discussion today would be really useful to understand your views on this topic.
Okay, I can only give some hints, so to say, or maybe again looking back since the launch, where we had to focus to build the governments, but mainly the governments at EU level, and then launch the mission hubs, at least to have the second layer, so to say. Recently, as you may have seen in the work programs, there's some notion of the regional participation, the regional perspective. So as a clear requirement to involve the regional public health authorities to get information that they know about, that they're involved in the work. So this way, I think we can try from the EU level to engage more, but it's not an easy thing to also say. It's also goes back to reaching out to regions. For us as the Commission, there are limits what we can do in terms of going to events and explaining what are the missions about, what are the funding opportunities. We are in regular interaction with the regional organizations in Brussels that then have obviously their partners in member states like Eurega and ARIN, so that at least they are well informed what we're doing, that we often invite them to events to give the regional perspective of things. And this is also something we would like to enlarge. But there were some resource issues to be as inclusive as we wish to. So we had to prioritize the ministry's dialogue, but I think more and more, and I mean, obviously ECOS again plays a major role in that. It trickles down. We find ways to, also go to the regional level and have more engagement also directly with the mission activities. The bus roadshow being also an example. As you have seen, they're not all in the stopping and circulating in the capitals. No, they go into the regions and smaller towns. That's where we want to also land.
And of course, for the cancer mission implementation at local and regional level, we should not look only to the European Commission, and I think is mainly the task of different stakeholders in national, regional, and local level to, as you said, to understand the cancer mission and to be activated and to stay activated on the topic of the mission. And this, I think, based on our experience, this is an early sign, a very good sign, I may say, of engaging with the citizens and activating local authorities, just to give one example. And it's really important to keep them activated, because yeah, as I said, we shouldn't look to Brussels for in order to understand how to implement the mission in a local or regional level. But discussing about stakeholders, and this is a key for the success of the cancer mission, the ability to include all the relevant stakeholders all the time, actually, on all the topics. And I'll link this as well with the citizen engagement. And based on what you experience so far, what are the main challenges or barriers? Because this is something new, wasn't done before, or at least at this scale, the stakeholders engagement. And maybe you can share some early learnings on this.
Yes, indeed. Also, this is an area which at the very beginning we did only occasionally. So engagement, something we would like to do, obviously, in a very systematic way, but first how, and then again how often, on which actions. When developing work programs, the main interlocutor are the member states. In April, first time there was for all 5 missions, but I think for the total work program 2025, developed orientation documents which were published, and stakeholders could send in some input, let's say, which we then obviously looked at. For the cancer mission specifically, so far, what we have done together with our colleagues from DG Santé is a couple of stakeholder webinars on the health policy platform. At least I think in terms of outreach is good to get some feedback, but it's not covering all the activities we are doing. This is, well, we have to see how much we can open up this. Maybe as a side note, I mean, it's not that difficult, obviously, to engage with the European stakeholders in terms of European organizations. I mean, they contact us, we're in discussion, we go to their events and so on. But obviously, you're pointing to the national and local stakeholders. And there, again, there's a bit of limitations in terms of resources, also in terms of translating, what we think in Brussels, so to say, or develop to translate them. I think we have limited, not just capacities, but also knowledge, or we are probably not the right persons to do that. So it's more and more what you should do to activate the national organizations to take care of that. Again, this I think is still a bit lacking, that we could do better. We very much rely on our mission board members. There are 15 of them, and they are act also as ambassadors in most of the countries, going to events, interact with the national stakeholders, with the ministries, and they provide us the feedback we need in Brussels. Then that they say, oh, interesting event, I talk to these kind of people. So they regular report to us, what they have done, what are the discussions at national level, what are the kind of considerations, or missions not so relevant, or we don't know about. So we get this feedback through them. That's a very direct way to do, very, very helpful. Then also do it through, the interaction with ECOs. I think we get some important feedback, but it's always through somebody. It's a bit less than that we directly be on the spot or really can engage with the national and regional stakeholders. Brussels, yes, I mean, that's anyway part of our work.
So we are slightly moving towards the end of our webinar. So this is the last chance for the people in the audience to ask, let's say, one final question to Annika Nowak from the European Commission. So the time is now to ask one final question or to send one final comment. But in the meantime, I would like to ask you, Annika, to add, I don't know, something that wasn't in my questions, in the questions of our attendees today, and something important that missed in our discussion today, if any.
Well, if I look at my list, I noted some of the questions. I think we almost covered everything. I wouldn't know that we haven't touched upon anything important we're working on and I haven't mentioned, maybe. No, I think well done.
Yeah. So I would like to first thank you, Annika, for being with us today and for being so open, answering all the questions. And I would like to thank to our attendees because they ask so many questions, really concrete, very good and very useful questions. Thank you so much. It was a very high level of interactivity in this webinar. So thank you all. And I think we can close here. And I wish you good luck with the cancer mission implementation in Brussels or in member states, in regions, and at the local level. Until next time.
Thank you very much. It was a pleasure. Goodbye, everybody.
Thank you and goodbye.